Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing fabulous. How was your weekend?
Fantastic.
Excellent. Well, we have three excellent guests today. All of them are currently residents at the North Colorado Medical Center Podiatric Medicine and Surgery Residency Program. Callie Morlock, welcome to Dean's Chat.
Thank you.
Now you are about to graduate. You're a third year.
Yeah. Exciting.
Congratulations. I can't wait to hear about your plans coming up. And
Thanks.
I'd like to introduce everybody to Michelle Yoakim. Michelle, how are you?
Good. Thanks for having me.
You're very welcome. It's great to have a AZCPM alum on. And Jusitn Frazier, welcome to Dean's Chat.
Hey, thanks for having me on.
Sounds good. And you're from DMU, right?
Yep, that's correct.
All right. And Callie, just remind me, you are from the Scholl College of Podiatric Medicine.
I am, yes.
All right. Fantastic. So this is a special episode for me because 20 plus years ago, I was part of a small group of docs that started the North Colorado Residency Program. And I'm always so proud of all of you, and I follow your careers and watch you go all around the country and be successful podiatric physicians. So I'm sure that you will keep that trend going. So way to go. So what I'd like to do, we got a big agenda today, right? We're going to talk about the North Colorado program. We're going to talk about the first year, the second year, the third year, and we're also going to talk about the externship experience because every day, every week, Joe and I are meeting with students from our college that are looking for great opportunities for clerkships and potential residency programs. So we're really excited that you have taken the time to meet with us today. So, Michelle, why don't we get going, if you don't mind starting? Tell us a little bit about the North Colorado Residency Program, and then perhaps, Callie, you could talk about the second year, and Justin, you could talk about the first year.
Great. So our program is a 3-year PMSR RRA program, and we really pride ourselves in the types of cases that we have here. We have a number of different attendings that we get to work with, and each one of them brings something new to the table that we get to experience. And something else that we really love is with that variety comes a number of cases that we feel like as residents, we're getting so much hands-on with and getting to work with the attendings from pre to post-op. So it's a really great experience in general.
So as a third year, what's been the highlight of your third year as a resident?
Oh, the highlight of my third year. I have really enjoyed getting the third year experience here because we're very hierarchy based so far. So in your third year, you get to have the pick of the cases. You get to go to any case that you want. And you get to kind of establish a deeper relationship with each of the attendings in that process. So that's been really nice so far.
Now, you have also had an opportunity to do some mission work.
Yes. So Callie and I were very fortunate, actually, because of just the way things worked out with COVID. We each got to experience one of these trips at the end of our first year and then again in our third year. And that has been one of the best experiences with Dr. Hatch. And recently, Dr. Atherton from our program has started joining in on these trips. And it's working with these kids in the Yucatan is just it's such an experience. It really makes you take a step back from everything that we have here and realize just what we can do to help those around us.
Oh, that's very well said. You know, I used to work with Dr. Charles Sutherland. They've renamed the Yucatan Cripples Children Project to
so great
in name of Dr. Sutherland. So I'm glad you had the opportunity to work with him.
Yes, he's wonderful.
That's great. Callie, can you share with us also the experience of what it's like to be a resident at North Colorado, but what perhaps that second year is like in particular?
Yeah, so our second year, kind of like what Michelle was saying, you sort of progress throughout your years of all the opportunities and variety that you get. But I would say your second year is kind of a year where you get to figure out yourself a little bit more, figure out things that you are most interested in because you're getting more of a variety. You're not necessarily one of the third years that's picking the cases that you want every single week, but you're also still getting a variety of, oh, okay, I have this attending this week who I haven't worked with, but I know they're great. This is kind of a new perspective that I haven't seen my first year. And now I'm getting to discover new ways that I like to do things or ways that other people like to do things. So it really helps build your skill set and your options that you have for different cases, different clinic experiences, just everything.
I remember back in the day, the residents used to talk about the traveling between Greeley and Denver. I imagine you've put a lot of miles on your car.
We definitely do, but one of the residents when I rotated here as a student put it really well, in my opinion. He said that since we live so close to our main hospital base, when you're commuting there, it's only a 5-minute commute at most. And then when you drive to Denver, even though you're driving a little bit farther on average, it's still roughly the same as if you go to other programs and you live 20, 30 minutes away. It's just more at a single time.
Right. And it's kind of counter traffic sometimes too, based on your schedule, for sure. Well, very good. I'm sorry, Joe. I seem like I'm doing all the talking here. Jump right in.
No, but this is great because this is a great question that students will often ask. So in terms of the way that your program's set up, when you say your kind of core hospital, when you have your rotations, is it set up in such a way that if you were down in Denver, are you there for an extended period of time? Is it just like 1 week at a time? Would it make sense to have a place there? Or how does that work out best for you guys?
It kind of varies on how our schedule looks. So we usually go on a week-to-week base for our scheduling. It's not necessarily a certain rotation where you're down in Denver. It's more of you may go down once a week, you may go down a couple times a week, but then there are also times where you may not go down for several weeks and you're just closer to the Greeley area. So it all very much depends on sort of the cases that you're going to, the attendings that we have down there, and what their schedules are.
Are you taking call from any of the hospitals in Denver?
No, we are not.
Okay. So that makes it a little easier too.
Definitely.
So Justin, you are the younger, the junior resident here on the call. Tell us about that first year of residency and what it's like as a resident at the North Colorado program.
Yeah, it's been a great year. Definitely anytime transitioning from student to doctor, it's definitely an adjustment period, but I feel like anywhere you go, there's going to be a sort of an adjustment period. I love the aspect of this program is that we take call early on. So I really get a lot of good experience with my technical skills and treating patients early on. So that I feel, at this point, I have a little less than 2 months left in my first year. And I feel completely confident going into second year, knowing that I'd be able to handle any sort of cases or call things that come up.
Very good. Do you want to transition into the extern experience? Joe, if you want to lead that.
Sure, but I have one more question about call. Okay. Only because again, these are the things, right? So is it all of the call is focused in the first year? Or how does the third year take buddy call? Do they take any call? What does that look like?
Yeah, I can answer that one. The 2 first years that we have share call every other week for the first 6 months, with the exception of July. July is kind of the first month that you take buddy call. And so you're kind of paired with the 2 second years doing buddy call for that month. And then come August, the 2 second years kind of go on phone call. Okay. So they're available by phone to help out. But then that's when the first years kind of spread their wings and start taking call. So.
Beautiful. So
we recently changed our call schedule from what people may have talked about in the past. It was something that we wanted to change to improve our program. And I think we did by changing that, some of our first year call and second year call. And I think it's been a good year with that change.
That's wonderful. All right. So I love it. Let's shift gears to the extern experience. So can you talk a little bit about how many externs you take and what do you think, now that you have all been on the other side of what it's like to work with students, what makes a great student? We'll start with Michelle and we'll kind of move through.
Okay, so we do take 2 to 4 students every month. It varies depending on the month. And in terms of what makes a good student, honestly, for me, one of the biggest things I'll say is effort, just the amount of effort that they put in during their time here. We definitely are very laid back in our rotations for students. We don't expect too much from them. We don't have them take any call. And so we want to see what they're going to be doing with that time. Are they going to be asking us the questions about cases? Are they going to reach out to see what we're doing, what types of cases, and why we do these things for these cases? And also just taking the time to explore Greeley and asking us about what our experience has been like living here, because it's not for everybody. And I want to see that they're putting forth effort to see what their experience would be like as a holistic approach of living in Greeley and working with this residency. So number one for me above everything else is effort always.
That's wonderful. Callie, what are your thoughts?
I 100% agree with what Michelle was saying. We aren't a super intense program rotation wise for our students, but it's partly because, like Michelle said, we want them to see the area. We want them to have a good experience and see the area that we have to offer, because there's not a best program for every single person in the country. It's what you want to get out of it. So we really want to show you what we have. I think for me, being a good student is someone who's really engaged as well. We want you to show up and we want you to put the effort in, but we also want you to be interested. We want you to, like Michelle said, ask us questions, ask us why we do something. Sometimes, especially in the earlier months of the year, it's some of their first rotations. So we really like teaching them and we really like telling them how they can improve on their student skills as well, but it also takes their interest as well.
All right, Justin, words of wisdom, how to be a good student.
I completely agree with my senior residents. I will say there's the two things that I'm looking for is professionalism and then also personability. So if you're supposed to be somewhere at a certain time, it's like a good act of professionalism to be there at that time, or even give, the residents a heads up, like, hey, something happened, so I'm running late. Just that communication aspect. And then, personability, how they interact with others, how they interact with the residents, the attendings, and even their fellow externs. So that those two, professionalism and personability, are the two things I kind of look for when externs rotate through.
I love that. I'm going to summarize real quick because you gave really easy things to remember. 2 E's and 2 P's. Professionalism, personability, engagement, and effort. So everyone can walk away with those 4 items to work on. I'll throw it back to you, Jeff.
I always thought one of the neatest things about the residency program was the fact that the hospital provides housing for externs, and because that's huge, because that 4th year is very expensive and there's a lot of travel involved. Can you talk about the clerkship schedule, if you would, in addition to the fact they get to live at the hospital? Michelle, go ahead.
Oh.
Or Callie, go ahead.
Oh, go ahead.
Right. For the clerkship schedule, so they can come in and they do have the option to stay in the housing that we provide. And it's just a couple $100 for the month. So it's pretty reasonable. And then for their schedule, it really just depends on what our schedule is week to week. We try and give them a very well-rounded exposure to our program. And so we want them to see what the elective cases are, what the inpatient cases are, and also a little bit of the inpatient life where our residents are on call. And then they also do rotate with us in our clinic.
Kyle, we went cold. Everybody's frozen. Which is okay. Hopefully,
because we do want to give them the whole experience. But we really want the students to have a full experience. So we have them go down to our Denver clinic more often than residents do, because we want them to spend time with Dr. Jacola, who's our clerkship director. And we want them to spend time with all the attendings around that office as well, because they're a big part of our program. They're just a little bit farther away. It's not necessarily that we go down there all the time, multiple times a week, every week, but we want them to experience them as well.
That makes sense for sure. All right, let's shift gears a little bit. Let's talk about the future. Callie and Michelle, when you sent your CVs over, both Joe and I noticed immediately that you already had your fellowship program on your CV, and so that's the next steps. Fellowships are so popular now, but there's a lot of students applying to them. Joe and I just talked to a fellowship director that has 70 third years applying for his fellowship program. So congratulations to both of you for getting a program. Can you each talk about the process? Because a lot of residents out there are trying to figure out what they're going to do with their lives after the third year, right? Callie, if you don't mind starting.
Sure. So Michelle and I were lucky because the 2 third years in our class above us also participated in fellowship. So we did have some guidance from them as well, which was extremely helpful. From my experience, I was looking more in the Midwest to sort of not really the Pacific Northwest or California region. So there wasn't necessarily set timelines for mine. It was kind of a lot of word of mouth, a lot of talking to the fellows, a lot of talking to the attendings that are there and just getting a good feel of the programs. Something that I felt like really helped was reaching out to the fellows. Even though they're not necessarily the fellow that would be the year above you, they still provide a lot of information. And if you have formal interviews with a program, they're usually there and they can advocate for you if you had a good conversation with them. And also just connect you with more people as well, even if it's not necessarily their program. It's such a small profession. We're all kind of interlinked and they always know someone else at another program or know another contact where even if you look elsewhere, they still are willing to help you out.
So Callie, your program that you're going to is the Advanced Foot and Ankle Reconstruction Limb Salvage Fellowship.
Yeah.
That's a mouthful. And it's in,
yes.
and it's in Salt Lake. So that's incredible. Did you know you were going to do a fellowship a year ago, 2 years ago? Well, how did that all play out in your decision making?
Yeah. For me, I came into residency and I honestly wasn't sure. I didn't know if I wanted to do a fellowship. I feel like when we started residency, they weren't quite as known or quite as in vogue as they are now. So their knowledge into what I wanted to do and tailored my interests, that's when I really started looking for the fellowships that I wanted, more of the limb salvage, reconstruction types of fellowships. So I was uncertain, but then as time progressed more, the beginning of my second year in the fall is when I really started getting serious about them.
Well, that's great. So, Michelle, you're going to the Newport Advanced Foot and Ankle Surgery Fellowship in Newport, California. Can you kind of share the same thought process that Callie did? When did you start trying to figure out what you wanted to do, and when did you decide you wanted a fellowship?
Yeah, so I actually decided that I wanted to pursue fellowship when I was in medical school. It was something that I wanted to ensure that I had as much training as I could possibly have. And so I knew that I wanted to try. And then, like Callie said, our residents above us had both pursued great fellowships. And so we had that insight, which really helped as well. And what that gave me was the idea that this is the way to advance my training and maximize my training, and to also be part of the trend in podiatry right now, the way that it's trending towards having fellowship trained individuals joining practices. And so that all came about later after I started exploring it more in residency. But all of that added to why I wanted to do one. And then in terms of the path of pursuing one, it's getting earlier and earlier, but I think both started maybe sometime at the end of, the middle of our second year. And now it's becoming earlier and earlier, but that was when we started, and we just both started going on interviews and visiting different programs. And like Callie said, it's about who you talk to, the relationships that you're building along the process. And unlike Callie, I stuck to the West Coast. My family's from California, so I wanted to stay within that area. And I was very particular about the programs I did choose to apply to and to interview with, because while I did want a fellowship, I wanted it for specific reasons to build my career. And so I didn't want to have one just to have one on my resume. And so at the end of it, after I think it was 5 or 6 different fellowships, decided on the one in Newport because of what he was offering and the type of training I would get to help me in the future.
That's great. I noticed on your CV that arthroscopy is an area of expertise for the fellowship. I'm going to put a shameless plug in here, Joe. We just got 3 ankle arthroscopy simulators at the university.
I think that I saw that on Instagram, which is amazing.
Yeah, so if you need to hone your skills, just let us know. You come down and visit in Phoenix, we'll let you play on the simulators for sure.
Yeah, if you're ever in Phoenix, you let us know.
Perfect.
For sure. So Justin, you've been watching all the senior residents going off to fellowships. What's your plan, or don't you have one yet?
Yeah, so great question. As of right now, I'm considering a fellowship. I'm kind of testing the waters, reaching out to different fellows I know or certain people at programs that I know. For me, it's kind of an interesting story, a little background about my demographic. Like, I'm a dad and have 3 kids. So for me, I have to be kind of selective on like where I'm going to apply for fellowship. So that's kind of where I'm at right now, is just kind of testing the waters and see what happens. But I've already started reaching out to different fellows that I know, and we'll see what comes of it.
That's fantastic. Joe, what happened to the days when you just did your residency and you found the best job possible and you went for it?
I think they still exist. I think what fellowship offers, though, is an opportunity. So to Justin's point, like, I don't know yet. I've been, 11 months into my 10 months into my training. I think it's perfectly okay to not have the answer yet. And I think there's still absolutely a place where you get absolutely fantastic training. And I don't think that it's true that you quote unquote, need a fellowship to be successful. I think a fellowship is an opportunity to build confidence, to maybe acquire skills that you want more experience in. But I don't yet view it as a requirement to training, or I don't want people to look at it as, to your point, Michelle, I'm going to do it just to have it on my CV, right? You don't want to, you're investing a year of your life in an opportunity to grow and learn. You want it to be that. So I think it's perfectly appropriate, Justin, to take your time and figure out what's right for you, the way that you want to practice, what a fellowship might actually bring to you that not doing it would not bring to you. I think similar to how people look at like MBA programs, not to get totally tangential, but for a lot of professions, having a master's degree doesn't actually earn you more money or do anything for you than, look at how great I have this master's degree. And in other fields, it's a huge asset and investment. Just to check a box. So I love that we have a diversity of opinions in our residents here. I have a question for Justin so that he doesn't have to feel left out either. As you have gone through your first year, can you talk a little bit about what it's like to go through different rotations and kind of how your rotations are set up in terms of, is it like 1 month rotations on different services? Does that go into the second year? Is it all in first year?
Yeah, that's a great question. So how we have it at this program is the majority of our off service we do in our first year, but we continue on second year and do like a minimal amount of off service third year as well. How we do it, it's usually broken down into either 2 weeks or 4 week stints. Okay. We have a couple of off service rotations, which are only 1 week long. But I think so far I've done 5 off-service rotations. And actually, I'm currently on my emergency department off-service rotation as well. So, I got about 2 more weeks of that. So that's a 4-week rotation here. But really love the opportunity to work with other professionals. We have a really good reputation here at our hospital among the different specialties. So just really enjoying my time kind of learning, the full spectrum of medicine.
Very good. I'd love to spend a couple minutes with each of you talking about how you found out about podiatric medicine, how you found your school of choice, and then how you ended up at the North Colorado program, because the times are changing, right? Not just for fellowships, but they're also changing for students because there's more programs available than there are students applying to them. So in the old days, we used to say, we want you to apply to 15 to 20 programs. Now many of our students are only applying to 3 to 5 or 6 programs. So we'd be very interested in hearing your story. Justin, you want to go first?
Sure. And that's regarding applying to a school.
Yeah. Well, how'd you find out about podiatry? How'd you decide to go to DMU? And then as the process kind of played out, how'd you end up in North Colorado?
Sure. Yeah. Basically, after I graduated from the University of Northwestern St. Paul, Minnesota, I spent some time working as an ED technician. And I realized while I was doing that, I really enjoyed like the wound care, irrigation, debridements. I kind of did at bedside, along with the different splinting. 2 more things kind of like spurred my interest in podiatry. The first being my wife actually dropped a knife on her foot and severed her EHL tendon.
Oh my.
And so we basically did our appointment consultation with the surgeon. He was a really cool guy. I was interested in the medical field, so I kind of asked him about like his life and what he does. And as I was talking to him, like, I kind of want to do exactly what he's doing. And sure enough, he was a podiatrist. And then the last thing is I got a recruitment email from the AACPM talking about like, hey, have you considered getting your white coat through podiatry? And at the time, I'm like, well, no, during undergrad, no one had ever talked to me about podiatry. So I'm like, you know what? I'll just click the link. So the recruitment email got me to the website. And as I was reading about the field of podiatry, I kind of fell in love with it and ended up applying to DMU. And I'm originally from Minnesota, so DMU was the closest to my family. And as I visited the campus, I knew that was where I was supposed to be. And then kind of continued on during 4th year, trying to figure out kind of where I want to do my residency. Like I had mentioned earlier on the show here, I have a wife and 3 kids. My wife is originally from Colorado, so we kind of were looking, out west from kind of the Midwest. And so I ended up doing the 3 Colorado programs. I rotated at PSL, Denver Health, and the Northern Colorado program. And by far and away, this was my favorite program. So just the sheer amount of diversity of cases, and just it was a complete package that I felt like couldn't be beaten.
That's great. Yeah, our students do like to go on the trifecta in Colorado. Those are 3 programs that are attractive, and really you get phenomenal training at all of them. So that's great. That's a great story. I think it's interesting that the email from AA, you clicked on it and then dove in further. So that's fabulous.
It got me.
I guess so. Callie, would you mind sharing your story with us?
Sure. So kind of similar. I didn't know anything about podiatry until I went to undergrad. So I went to Marist College in New York, and one of our classes that we need to take if we are thinking about pursuing a medical field is sort of a 1-credit pre-med course where once a week we would have different health professionals come to our school and talk to the group of us and share their experiences. We also had opportunities to shadow different people. And I really was drawn to the podiatrist that came and presented to us. He really was the one that seemed the most satisfied with his career. He seemed very excited to go to work every day. He was very excited about his patient population, and not that the other careers weren't, but something just seemed different with him. There's just a little bit more of a spark, I felt like. So that's how I really kind of dove into it. And then, so I graduated from my undergrad and I went straight into podiatry school. So I applied to multiple schools, and I actually applied to the Chicago school last and was about to not go on my visit there because I had been accepted to a couple other schools that I liked as well. But I figured, I'll go see what it's like. And then once I was there, sort of like Justin, I really felt like it was the school that I wanted to go to. I really liked the interprofessionalism that the school had to offer with the MD school, the pharmacy school. Just having those different professions, I feel like really elevated the school. And that's why I chose to go there. I am originally from Colorado, so that's sort of my connection to the Colorado region as well. I rotated, it was actually my first podiatry rotation as a student, so I was very early on. So students who think that they're early to program don't have a chance, it's definitely not true. You have an equal chance to everyone else. I just liked the area. I liked the people a lot. I did come back and visit in July, which is actually coincidental because it was the month that Michelle was rotating here. So we unexpectedly met each other just for a couple hours at one of the academics. And I just liked the people. I liked the diversity. I liked the autonomy, just everything it has to offer.
That's a great story. So Michelle, I know your story, but will you share with all of our listeners?
Yes. So I had a little bit of a different path. I did my undergrad at UC Riverside, and I was just on the MD-DO track. I didn't know what podiatry was at the time. And then I did a post-bac program, a one-year post-bac. And at that time, I got my first exposure. There was one podiatry student at that program. And at that time, that was all I knew about podiatry, was what I learned through her. And then afterwards, I actually took some time to pull back from medicine because I wasn't entirely sure what I wanted to do within the MD-DO track that I was on. And I did some teaching at that time, and I still felt this pull towards medicine. I just didn't know in what capacity. And that's when I decided to start shadowing a bunch of different doctors. I shadowed several different fields, podiatry included at that time after I'd learned about it. And I found myself going home from my shadowing of the podiatrist feeling the best, feeling energized after a long day, because I really liked what I got to see and what I got to do and the conversations that we would have throughout the day. And I actually thought it must be some fluke. This can't be as enjoyable as it is. And so I shadowed a second podiatrist afterwards for a few weeks at that time as well. And I still felt the same way. And so I went on to shadow a third podiatrist because I wanted to really feel secure in my choice. And I did, even after the 3 different experiences, one being primarily clinical, and then the other 2 having more surgical and clinical. And I was sold. And so I started on my path towards podiatry. And I actually went to the Western, the conference at Disneyland, and I met Dr. Wisman, who's one of the teachers at Midwestern. And I really loved him. I thought he was great. He was so nice. And so I was drawn to the school already. But then I started doing my interviews. And after I got my Midwestern acceptance, I actually canceled everybody else because I really loved the campus. As Callie said, with her experience at Scholl, I loved that we would also get the experience with the DOs, and we had a very strong medicine foundation that we would work with at Midwestern. And I loved the environment. So I am from California, but I'm from a pretty small town in California, and Arizona felt good. It felt like home, and it didn't feel like out of place in that area. So it really sold me. And then going on to NCMC, where I'm at now, it really was a difficult decision. This was my first rotation that I did meet Callie on, so it was very serendipitous. But I felt myself constantly comparing the other programs I went to this program. And I found that even though I was and still am very type A, making my spreadsheet of the different things that I wanted in a program, finding that every single program was checking each item off the list. And so what I had to go based off of was my experience here. And my experience in that month was really good. I felt like all of the residents were a team. There wasn't any animosity. The attendings were really nice. They were really invested in teaching their residents. And I felt like if I had a question, I didn't have to feel like, oh, it's too dumb to ask. I felt confident and comfortable to ask it here.
Well, those are three tremendous stories with three different ways of finding podiatric medicine. That's phenomenal. Joe, do you have any questions to add to that? Those were great.
No, I love this though, how it highlights too. You guys have all touched on this idea, both in schools and in residency. There's not one perfect program, perfect school. It's silly, but it's like dating, right? You kind of have to go and experience it. And to your point, Michelle, I don't think it's realistic to expect any one place to check all the boxes, right? Amazing for you if it does, like high five, you're done, right? But more often than not, maybe it checks 80%. And then you look at the 20% that it doesn't. Are those 20% things that you're willing to say, okay, I'm okay if that's not the strength here. And if they're not, then that's really worth looking at. Like, I really don't want to miss out on X, Y, or Z. And this program doesn't have as much. So then you could say, okay, well, is there a program that also meets 80%, but has a different 20? And does it then hit that box? Because trying to figure out, and I'm curious, and I'd like to ask you guys this question, as you were making these decisions, either consciously or not, what are some of the frameworks that you put around finding out what's really important to you and how to optimize what matters the most, but not at the expense of your training? And so, Justin, we'll start with you.
Yeah. So for me, one thing I had to consider was I'm not making decisions independently. Yeah. So like I'm making decisions as a family unit. So that kind of thought process kind of aligns with like what my goals are. So one thing that was on the top of the list on the personal side was, is there some sort of social support structure in place for my wife and kids? And that's just kind of like a family consideration. Yeah. But on kind of an academic and professional consideration, what is the experience like there? What's the diversity of cases? And that was one thing with this program that I really appreciated. And that was kind of at the top of my list, was like, what is the diversity of the cases? Can I graduate this program feeling confident going any direction in podiatry? And so for me, that was a yes.
That's fantastic. All right, Callie, go ahead.
Yeah, I think what Justin said too, you look for all the academic and all the educational experience. For me, another big thing was the kind of the collaboration between the residents, because I felt like if there's a lot of great programs out there, but if the residents as a whole don't work well together, they don't communicate well together, that's a fault of the program. So I really was looking for kind of a close-knit group of people who I wouldn't have a problem messaging a random question. If it's really early in the morning or late at night, I wanted to feel comfortable with the people that I was working with, because we would be colleagues, but also hopefully friends down the road too, because just because you're co-residents doesn't mean that you stop talking to each other after your 3 years. It's still people that you rely on. There's still people that are resources and helpful and support you throughout the whole way. So that was a big aspect for me as well.
That's beautiful. Well said. All right, Michelle.
Yeah, so for me, I did have that checklist, and I was looking for things like where I would have access to cadavers, where I would have an academic structure within my residency. And like I said earlier, most programs I rotated at along that West Coast loop checked most of those boxes. And so I had to pull back and say, where am I going to fit in? Where am I going to end up that I will have a mutualistic type of relationship where not only will I provide an aspect for the program to help grow it, but also they'll help grow me and help me learn and become the physician that I hope to be one day. And so that was how I found this program specifically, by looking at that aspect. And just like Callie said, I wanted to be at a place where I knew that I would have a support system, especially having my family back in California. I knew coming out to any program, if it wasn't in Southern California, I would need a good support system. And I saw that within the residency here. The first year residents that I met at the time, they were great together. It was their first month, actually. I was here in July. So And they were already building such a strong relationship, and the entire environment was great. And at the end of my month, Dr. Vardahl, our director, even had his exit discussion, which he does with all our students. And I was a little bit nervous for it, but it turned out to just be a very easygoing conversation. And it was a great way for me to get to know him and for him to get to know me. And I really liked that. And I felt like it fit into what I was looking for, a type of program that I'll get all of those things that I wanted for my education, but also where I'll get that support system.
Excellent.
You are all
They're a very insightful group, Jeff.
Absolutely.
I've got so many other questions I want to ask them now, but I'm going to hand it back to you.
Well, I think you're all very fortunate. Your attendings at the North Colorado program are wonderful, and starting with Dr. Vardahl, what a tremendous program director, and then of course Dr. Jacola and Dr. Weber. They're graduates of the program. Granted, it was a while ago, but they're so excited about training the next generation. So you've been a recipient of that. So that's wonderful. I really don't have much else to ask or talk. If anything else that you'd like to highlight, Joe?
I'd love to ask one more question.
Sure, absolutely.
So as residents, in terms of receiving feedback, what are some things that you have felt has been really successful? Because you guys have already touched on this, right? Like how you learn, how you interact, how you engage. What are some of the ways that you've received feedback that you think was really successful? Let's start with Callie this time.
That's a great question. It's kind of tough too, because everyone's a little bit different, but I think good ways to receive feedback is sort of by asking questions in a way too, because if you are asking questions and you're diving deeper into what you're learning about, it kind of shows that you're preparing and that you're thinking actively about maybe what the next step is, what the next possibility is. So receiving feedback in a way of working together, asking questions, bouncing ideas off each other. I think not necessarily there's a clear, there you have a mentor and you're the mentee. They're helping teach you, they're helping train you. But if you can kind of find that line of where you still are colleagues and professionals that are working together, where you can still learn from one another, I think that's probably a really good way to receive feedback and to improve upon yourself.
That's beautiful. Justin?
Yeah, I think to kind of echo that, I think it starts with sort of a mindset to be a little bit introspective, like how can I improve on this? And really, you establish trust with your co-residents and your attendings so that you feel comfortable asking like, hey, this is how this went. What's your feedback? I want to grow. I want to learn from the experiences. And just kind of in a tangible way here at this program too, we meet with Dr. Vardahl on a regular basis to receive feedback about how we're doing and then discuss the program or even the future of your career. So I like that this program emphasizes feedback a lot. And then additionally, even off service, we have evaluations that we give the different attendings in different specialties, and they can evaluate us. And so it's really beneficial to kind of read what they have to say about us. And always an encouragement too when you're doing well, and then just a good tool to learn and grow, as well.
Excellent. Michelle?
I'll just echo what they've said already, that it starts within yourself and being open to that feedback. But some ways that we have feedback here is just like Justin mentioned, Dr. Vardahl meets with us several times throughout the year. And we also receive reviews not only from our off-service, but from our core podiatry attendings. I think that comes out quarterly, and they just give us feedback on all of the different skills that we have, and they have an area where they put comments. Some ways that I feel like within our residency, outside of the paperwork aspect of getting feedback, has just been in cases or after cases where you just ask the attending, you say, hey, how can I improve on this part that I was really frustrated at and couldn't get past for a little bit? And having that relationship where we feel safe and we feel comfortable, not only with our co-residents, but also with our attendings, to realize that any feedback that we're receiving is not meant to hurt our feelings. It's not meant to put us down. It's meant in only the way to bring us up. It's only meant to make us better as residents, as future attendings, and as surgeons and physicians.
That's excellent. Thank you so much.
Yeah.
Feedback is such a gift, and it's hard because sometimes it's not, not every program provides it maybe with some marked set points. So it's wonderful that your program is doing that. And I think you guys are all outstanding, and I'm really excited to see where your futures take you. So thank you so much for your time.
Thank you.
Absolutely. I do have one last question. Who's the driving force behind NOCO's social media efforts?
Callie and I primarily.
Okay. All right. I can't open Instagram or Facebook without just warms my heart to see all the great things you guys are doing.
We're glad. We feel that social media is definitely part of medicine now, and we wanted to take advantage of that and show everybody what we're doing. And it doesn't necessarily, as I'm sure you see, it doesn't necessarily always have to be just the cases that we're doing, but it's also the environment that we're hoping students can see.
Absolutely. And you're going to be part of social media and YouTube with the Dean's Chat episode here.
Yeah, can we put a link to their social media for students and residents?
Yeah.
Not residents, but students to find? That's awesome. I mean, students are pretty savvy. They can usually figure it out better than I can, but nonetheless, we'll make it easy for them.
Absolutely. And we're going to be sending each of you a Dean's Chat cup with Joe's name and my name on it. So when you think back about Dean's Chat and all these tough questions we've been asking you can appreciate it. But
Yes, it's so difficult.
Yeah. We'll post you guys on our Instagram.
Right.
That'd be great. I said that tongue in cheek, of course. So thank you again for carving out time to meet with us. We're so excited to put the North Colorado program out as an episode about the experience of being a resident. I know that students all over the country will appreciate your feedback, so to speak. And so thank you again for being part of it.
Thanks for having
us.
You're welcome.
Thanks, guys.
You're welcome. All right. Cheers, everybody.